Hi, welcome to chapter 13. So here's the deal. These chapters the lecture is going to be a lot shorter and quicker, just because I'm just going to mention certain points that you need to focus on. So I'm not going to be going through each of these slides. I'm going to just point out different things that you need to know. So with with the infectious, we are looking at organisms. So one of the main terms you're going to use a lot is going to be infection. Okay, so this could be infection, and you can look for staph, infection, E. coli. So keep that in mind. With also, you have late effects, which again, remember that is sequela. We have TB codes. Okay, so the thing that I want to get to and focus on here is sepsis. So with sepsis, we have the appropriate code, group A, group B, the type of sepsis, that's what you need to look at. We have viral sepsis. And then again, just other different types of sepsis. So with sepsis, we have lab values. These can neither be assumed nor ruled out on the basis of lab values alone. So again, make sure the doctor is documenting somewhere, okay? Again, a code for sepsis is assigned only when the physician makes such a diagnosis. So keep that in mind. You can't go off by lab values. We also have bacteria. Again, one is with bacteria in the blood. The other one, again, is going to be with urine. The only thing I always tell students here, if we're going to code a UTI, make sure you look in the documentation to see if we know what type of organism or infection is causing that UTI, because we need to code that also. Urosepsis is just bacteria in the urine, not blood. Okay, so again, sometimes this can progress to a UTI. It can become generalized sepsis. Okay, and then we have systemic inflammatory response syndrome. So with that, there isn't really anything. We have the non-infectious origin. We have R65.1. Okay, so then we get into severe sepsis. All right, so with this, it's just further divided with septic shock without. We shouldn't here, if we're coding R65.2, severe sepsis should not be assigned unless severe sepsis or acute organ dysfunction is documented. So again, to assign that, you need some good documentation. And the other thing, it needs a minimum of 2 codes. Okay, so you underlining condition, which example is going to be an A code or a B code first. And then, but if that organism is not documented, just assign A4 1.9 sepsis on unspecified organism. And then you're going to code the sepsis itself. Okay, so keep that in mind. If the reason for admission is both localized infection and sepsis or severe sepsis, at this time you want to assign the systemic infection first. And then your secondary diagnosis is going to be the infection. Okay, so here it just gives you some example. We have sepsis due to E. coli, and then we have an UTI. So here we're covering the sepsis, what's causing, again, due to the E. coli, which is a combination code here, and then we have our urinary tract infection. Again, procedural infection first. We code the code for the procedural infection, second code for the infectious agent. Again, T code here for infections following infusion, transfusion, second code for the agent. So my words to you is to follow these slides, especially when sequencing, so you know when to sequence what and what time. Okay, so let's go ahead and get to nosocomial infection. Again, these are hospital-acquired infections. Sometimes you're going to need an external cause codes for these. And then we get into our MRSA. So these are drug-resistant infections. You're going to code MRSA quite a bit. So again, MRSA for what? Is it for sepsis, infection, pneumonia? We have MRSA infection that's resistant to staph. We have the codes for that. Drug-resistant. Okay, so basically what I want to get here to our last big section of the infectious is AIDS. Okay, this is a big coding thing. So with AIDS, when you have all types of B20 is assigned for all types of HIV infection, which are described by AIDS. Okay, as you can go down the list here, HIV disease, here's an important part. It says symptomatic. That means they're showing symptoms. If I have an unconfirmed diagnosis of HIV, I do not assign the code B20 when the statement says possible suspected. Again, nobody wants an AIDS diagnosis on their chart unless it is confirmed by the physician. So as a coder, whenever you see possible, likely HIV, you cannot code it. You're going to code the sign or symptom that they have or had when they came in. Couple of different things here with AIDS is that we have testing. So we have asymptomatic. This is a patient without prior diagnosis of HIV and determine their status. Okay, so it's Z11. That's encounter for screening. Patient shows signs or symptoms of illness or has been diagnosed with a condition related to HIV. Once again, you assign the signs and symptoms. Okay, so here again, we have some testing codes, so make sure you look at those codes here. Now we have test result is positive, but that patient shows no symptoms of HIV infection. So you're going to code Z21, which asymptomatic, no signs or symptoms of HIV. Keep in mind, okay, that means the patient has HIV. It's not termed into the word AIDS, okay, and this is a good example. Do not assign Z21 when the term AIDS is used. Okay, when the patient is under treatment for HIV or when the patient's describing any active HIV condition, you're going to use B20. Okay, Z21 again is asymptomatic HIV, not asymptomatic AIDS, HIV. Okay, so again, here's some more Z codes that you're going to use. Go ahead and read through them. Let's just do some sequencing. So a patient is admitted for the treatment of an HIV infection or related complications. Okay, again, B20 HIV is going to be principal diagnosis and then anything else. So if they have the pneumonia, whatever related to it. So if a patient with HIV is admitted for treatment of an entirely unrelated condition such as an injury. So let's say that they do have HIV or AIDS showing symptoms, but they come in for a fracture of the tibia fibula. Okay, you're going to code that as your principal diagnosis. Okay, and then the B20 is going to be secondary. AIDS, again, if somebody has something here, pregnant, B20 is going to be additional. Again, an OB patient has positive for HIV, but no signs or symptoms. We assign Z21. With this whole section, the biggest thing for AIDS is the sequencing. So if you have any questions, let me know.